Melasma can be an extremely frustrating condition, but let me share with you my tips and tricks for keeping it under control. I'm Dr. Nina Desai, board-certified dermatologist and mom of 4. I'm here to help you find solutions to your skincare concerns and share a little bit about my life. Make sure to subscribe so you don't miss a video. So what is melasma? Melasma is a chronic skin condition, which basically means, unfortunately, there's no cure for it, but we really can do things to keep it under control. What an individual with melasma is going to notice is this darkening or pigmentation that's occurring on their skin in this patchy, confluent form. Typically, it's going to hit the cheeks, the forehead, and the upper lip, really in those sun-distributed areas. But oftentimes we can even see it on the neck and much less commonly other places on the body. So melasma most commonly is going to happen in females between the ages of 20 and 40 and can happen on all skin tones. So when we look at the triggers for melasma, there are both what are called extrinsic and intrinsic factors. The most common extrinsic factor is going to be sun exposure. So individuals that are out in the sun a lot, who travel to tropical locations a lot, may notice that their melasma tends to flare at those times. Then we have the intrinsic factors. Intrinsic factors most commonly are going to be hormonal changes. Women who are on birth control or some other form of hormonal therapy and women who are pregnant tend to notice that their melasma flares in response to those hormones. We now know that there are other factors that exacerbate melasma pigment as well, and one of those is heat. So not only sun exposure, but heat as well. So I always tell my clients who have melasma, be really careful with things like hot yoga or hot masks or really hot showers or saunas or steam rooms. Those can actually exacerbate the pigmentation on your face. While there's no cure for melasma, there are certain things that we want to do to keep it under control. First is a really, really good at-home skincare routine. And the number one ingredient in that routine should, of course, be a good sunscreen. Using your sunscreen on a daily basis and reapplying quite often, every 2 to 3 hours, is really, really important. I also recommend using a tinted sunscreen for my clients with melasma because not only are you getting UVA and UVB protection, but the tint has iron oxides in it, and the iron oxides are going to help protect against visible light as well. So really, you want to make sure you're protecting not only against UV light, but visible light when you're dealing with unwanted pigmentation. So of course, when we talk about melasma, my favorite sunscreens are going to be those tinted ones. So I recommend the Elastin Hydra Tint, the Isden Aerofotona Ageless. I also love the Neutrogena Pure Screen Plus Tinted Sunscreen, the Ulta MD UV Clear Tinted, and the Color Science Sun Forgettable Face Shield Flex. So the next ingredient we want to have on board is an antioxidant. Antioxidants help protect the skin against what is known as free radical damage. This happens because of environmental exposures such as sun and pollution. So free radicals on the skin can actually trigger the formation of unwanted pigmentation and make melasma worse. So having something like a really potent vitamin C on board or another antioxidant solution is going to be really important when protecting your skin against melasma flares. I have a video where I talk about my favorite vitamin C, so check that one out for my recommendations. Next, of course, we want brightening agents, things that are going to help reduce the production of pigment in the skin. Of course, there's prescriptions like hydroquinone, but there are over-the-counter ingredients like alpha-arbutin, kojic acid, and tranexamic acid that I love having on board for my melasma patients. So for specific products, I really love Naturium's tranexamic acid 5%, the Inkey-List 2% tranexamic acid, and Elastin's Illuminate Brightening Serum. One of my favorite solutions that incorporates multiple ingredients is the SkinCeuticals Discoloration Defense, which has not only tranexamic acid, but kojic acid and niacinamide as well. The Skin Better Even Tone Correcting Serum has alpha-arbutin, which is an amazing ingredient for fighting pigmentation as well. In terms of alpha-arbutin products, check out Naturium's alpha-arbutin 2% serum. For my clients with really recalcitrant melasma, where it just keeps coming back, we talk about a medication called oral tranexamic acid. Oral tranexamic acid has been shown to reduce pigment production on the skin in the right candidate. This is a medication that really you need to discuss with and needs to be prescribed by your board-certified dermatologist. And of course, all of my clients who have melasma, we talk about getting on a retinoid. Sometimes I'll prescribe prescription strength tretinoin, and sometimes we'll use an over-the-counter retinoid based on what they can tolerate. But what we want to do is we want to help with what's known as cell turnover. We want to bring those dead skin cells to the top layer and slough them off so that we're getting rid of some of that pigment that's trapped in the top layer of skin. That will reveal more even, brighter looking skin. So if you are one that struggles with melasma, of course, you're going to have your skincare routine that's on point. But also, there are some lifestyle changes you can make to help with your melasma. So if you're one who likes to exercise or goes out for walks, make sure that you're using sun protective clothing. Sun protective hats can be really helpful. Also, avoiding the peak hours of sun between 10 a.m. and 2 p.m. can also be really helpful. And also remember to avoid your triggers. If it's heat, avoiding the saunas, the steam rooms, the really hot showers, the hot yoga, really to help prevent the skin from getting too hot. Now the million-dollar question is, how do we treat melasma in the office? So first and foremost, we have to know that there is no cure for melasma. We are working to reduce the appearance of the melasma, but because of all the internal and external factors that play into melasma, it really can recur. Whenever we do treatments in the office, I have that conversation that there is going to be some maintenance involved. Some of my favorite treatments for melasma are chemical peels that help to exfoliate the skin, help to brighten the skin and fight pigmentation, and low energy lasers that help to break down that unwanted pigmentation, but don't get too hot. Because remember, heat can be a trigger for melasma. So lasers that are really hot are not a good idea if you have melasma. Some of my favorite lasers to use are the Clear and Brilliant laser and the Pico Shore Pro laser, both of which are safe in my clients who have melasma. Another one of my favorite treatments for melasma is what is known as microneedling with PRP. Microneedling is a device that will help trigger collagen production and help trigger wound healing on the skin, but there is no heat involved. When we add PRP, platelet-rich plasma, which comes from your own blood, we spin it down, we take out the cells and signals to amplify the collagen production and the wound healing capabilities. We can also help to break down some unwanted pigmentation. So whenever we're talking about melasma, it's super important to understand that treatment will take time. There, unfortunately, is no way to make all of your melasma disappear and for it not to come back. But with a great at-home skincare routine, some lifestyle changes, and a few in-office treatments, and that is the right treatments, we can really significantly improve the appearance of your melasma and we can keep it at bay. Do you have any effective treatments that you recommend for melasma? Comment below, and don't forget to like and subscribe so you don't miss a video.